As we cross the age of 60, the body changes in ways that are not always visible but deeply impactful. Blood pressure is one of the most critical indicators of long-term health in seniors. High blood pressure often develops silently, without pain or warning, yet it quietly increases the risk of stroke, heart disease, kidney damage, and cognitive decline. And some of the most effective signals require no medication, no equipment, and no standing at all. As the body moves beyond the age of 60, blood pressure often begins to rise due to a combination of biological, neurological, and lifestyle-related changes that develop gradually over time. One of the primary reasons is the natural stiffening of arteries. In younger years, blood vessels are flexible and expand easily with each heartbeat. With age, the arterial walls lose elasticity, becoming thicker and less responsive, resulting in higher systolic blood pressure. Another significant factor is the aging of the nervous system. The autonomic nervous system, which regulates heart rate and blood vessel tension, becomes more sensitive to stress signals as we age. Even minor physical or emotional stress can trigger an exaggerated response, causing blood vessels to constrict and blood pressure to spike. This is especially common in seniors during nighttime or early morning hours, when the body's regulatory systems are less stable. Kidney function also plays a critical role. As people age, the kidneys become less efficient at removing excess sodium and fluid from the bloodstream. This leads to increased blood volume, which directly raises pressure within the arteries. Many seniors unknowingly consume more salt than their aging kidneys can manage, further contributing to elevated readings. Hormonal changes must also be considered. With age, levels of hormones that help regulate blood vessel relaxation decline. This imbalance promotes persistent vessel constriction rather than relaxation. Finally, reduced physical activity and prolonged sitting or lying down slow circulation and weaken the muscles that assist blood flow. Over time, this creates higher resistance in the circulatory system, making elevated blood pressure more likely even during rest. Bed exercises are medically effective because they work in harmony, particularly in older adults whose joints, balance, and energy levels may limit traditional exercise. When gentle movements are performed while lying down, the body remains in a supported position, which reduces strain on the heart and joints while still activating circulation. This allows blood to flow more smoothly through the veins and arteries, lowering resistance and easing pressure on the cardiovascular system. From a clinical standpoint, the branch responsible for rest, recovery, and healing. Activation of this system signals blood vessels to relax and the heart rate to slow down. This response directly counteracts the stress-driven mechanisms that cause blood pressure to rise. The process by which blood travels back to the heart. Muscles in the legs and abdomen act as pumps, assisting circulation even during small movements. Improved venous return reduces the workload on the heart and prevents blood from pooling in the lower extremities. A common issue in older adults that contributes to increased blood pressure. Another important medical benefit is improved oxygen delivery. Gentle exercise increases oxygen uptake without triggering strain. Better oxygenation helps blood vessels function more efficiently and supports healthier endothelial cells, which line the arteries and play a key role in regulating blood pressure. Additionally, bed exercises help regulate blood sugar levels and reduce inflammation, both of which are closely linked to hypertension. Because these movements are low impact and easy to perform, they encourage consistency. Regular daily activation, even for a few minutes, produces cumulative cardiovascular benefits and creates a stable environment in which blood pressure can naturally move toward healthier levels. Controlled ankle pumps are one of the simplest yet most medically valuable movements for older adults, particularly for improving circulation and supporting healthy blood pressure levels. While lying comfortably on the bed, gently flexing and pointing the feet engages the calf muscles, which play a critical role in blood circulation. These muscles are often referred to as the body's second heart, because every contraction helps push blood upward from the legs back toward the heart. As people age, blood tends to pool in the lower extremities due to gravity, reduced mobility, and weaker muscle contractions. This pooling increases pressure within the blood vessels and forces the heart to work harder to maintain proper circulation. Controlled ankle pumps counteract this effect by restoring the natural pumping action of the calves, improving venous return and reducing unnecessary strain on the cardiovascular system. From a medical perspective, this movement also helps reduce stiffness in the blood vessels. The rhythmic motion encourages blood flow, which improves endothelial function, the ability of blood vessel walls to expand and contract properly. Healthier endothelial function is directly associated with lower blood pressure and reduced cardiovascular risk. Ankle pumps also stimulate nerve endings in the feet and lower legs, improving communication between the nervous system and the circulatory system. This helps regulate vascular tone, allowing blood vessels to relax rather than remain constricted. Additionally, improved circulation enhances oxygen delivery to tissues, reducing fatigue and discomfort commonly experienced by seniors, because this exercise is gentle and low impact. It is suitable for individuals with arthritis, balance concerns, or limited mobility. Performing ankle pumps for 1 to 2 minutes in a slow, controlled manner can create an immediate sense of warmth and relaxation in the legs, signaling improved blood flow and setting the foundation for healthier blood pressure regulation. Slow knee-to-chest movement is a gentle yet powerful exercise that supports blood system and improving circulation in the lower body and core. When performed while lying on the bed, this movement allows the body to remain fully supported, eliminating strain on the joints and spine while still activating key muscle groups. Slowly bringing one knee toward the chest, holding briefly, and then switching sides creates a controlled rhythm that signals the body to relax rather than react. From a medical standpoint, this exercise helps reduce sympathetic nervous system activity, which is a major contributor to elevated blood pressure in older adults. The slow, deliberate motion, combined with steady breathing, encourages parasympathetic activation, lowering heart rate and reducing vascular tension. This response is especially beneficial for seniors who experience blood pressure spikes due to stress, anxiety, or poor sleep. The neck-to-chest movement also improves blood flow to the abdominal and pelvic regions, kidney function, and hormonal balance, all of which influence blood pressure regulation. As circulation improves, excess fluid and sodium are more effectively managed. Reducing pressure within the blood vessels, gentle compression of the abdomen during the movement also massages internal organs, stimulating the vagus nerve. Activation of this nerve plays a key role in lowering blood pressure by promoting relaxation throughout the body. Additionally, the movement helps release tension in the lower back and hips, areas where stiffness can restrict circulation and contribute to discomfort. Because the exercise is slow and controlled, it is safe for most seniors, including those with limited flexibility. Practicing this movement for several repetitions creates a calming effect on both the body and mind, supporting healthier blood pressure levels while promoting overall physical comfort. Deep diaphragmatic breathing is one of the most effective non-medication techniques for reducing blood pressure because it directly influences the nervous system and cardiovascular function. Unlike shallow chest breathing, which is common during stress and aging, diaphragmatic breathing engages the large muscle beneath the lungs, allowing the body to enter a state of physiological calm. When performed while lying in bed, the body is fully supported, making it easier to breathe deeply without effort or strain. From a medical perspective, slow diaphragmatic breathing activates the parasympathetic nervous system, often referred to as the body's calming system. This activation reduces the release of stress hormones such as adrenaline and cortisol, both of which contribute to elevated blood pressure. As these hormone levels decrease, blood vessels begin to relax, heart rate slows, arterial pressure gradually drops. This type of breathing also improves oxygen exchange in the lungs. Deeper breaths allow more oxygen to enter the bloodstream, which enhances cellular function and improves the efficiency of the heart. When tissues receive adequate oxygen, the heart does not need to work as hard to circulate blood, helping to lower systolic and diastolic pressure. Another important benefit is improved regulation of carbon dioxide levels. Controlled, slow exhalation prevents the buildup of carbon dioxide, which can otherwise trigger anxiety and vascular constriction. Extending the exhale slightly longer than the inhale sends a clear signal to the brain that the body is safe, further promoting relaxation. For older adults, deep diaphragmatic breathing also supports better sleep quality and reduces nighttime blood pressure spikes. Practicing this breathing pattern for several minutes creates an immediate sense of calm, stabilizes heart rhythm, and encourages the body to maintain healthier blood pressure levels naturally. Consistency and safety are the foundation of long-term blood pressure control, especially for adults over the age of 60. The body responds best not to intensity, but to regular, predictable signals that encourage balance and stability. Gentle bed exercises work because they can be performed daily without exhausting the heart, stressing the joints, or increasing the risk of injury. When the body feels safe, it adapts more effectively, and blood pressure regulation becomes more stable over time. From a medical standpoint, repeated low-impact movement trains the cardiovascular system to respond more efficiently. Daily circulation stimulation helps blood vessels remain flexible and responsive rather than stiff and reactive. Over time, this reduces baseline blood pressure levels and minimizes sudden spikes that often occur during stress or early morning hours. Consistency also improves nervous system regulation, allowing the body to shift more easily into a relaxed state when needed. Safety is particularly important for seniors, as fear of injury often prevents regular physical activity. Bed-based exercises remove barriers such as balance issues, fall risk, and joint pain. This increases confidence and adherence, which are critical for long-term results. When exercises are perceived as safe and manageable, they are more likely to become a routine rather than a temporary effort. Another key factor is cumulative benefit. Even short sessions performed daily create lasting changes in circulation, breathing patterns, and muscle function. These small improvements compound over weeks and months, supporting healthier blood pressure without placing additional stress on the body. Consistent practice also enhances sleep quality, which plays a vital role in cardiovascular health. Long-term control is achieved when movement becomes part of daily life rather than a reaction to high readings. Safe, regular bed exercises allow the body to maintain balance naturally, supporting sustained blood pressure, improvement, and overall well-being. What matters most to understand is that after the age of 60, blood pressure is no longer controlled by force, intensity, or pushing the body harder. It is controlled by consistency, calm signals, and respect for how the aging body truly works. These 3 bed exercises are not small or insignificant. Medically, they target circulation, nervous system balance, oxygen delivery, and vascular relaxation at the exact moments when the body is most receptive while resting, waking, or preparing for sleep. Many seniors believe that improvement requires long workouts, equipment, or aggressive routines. In reality, the body responds better to gentle, repeated movements that feel safe. When the heart does not feel threatened, it functions more efficiently. When blood vessels are encouraged to relax, instead of being forced to adapt, pressure begins to lower naturally. These exercises create that environment. The real power lies in daily practice. Even a few minutes each morning or night trains the body to regulate itself more effectively. Over time, circulation improves, stress hormones decrease, sleep deepens, and blood pressure readings become more stable. This is how long-term control is achieved without overwhelming the system. Safety should always come first. These movements are designed to work with the body, not against it. They are suitable for most older adults, including those with limited mobility, joint discomfort, or balance concerns. When done slowly and mindfully, they reduce risk while delivering real cardiovascular benefits. Blood pressure management after 60 is not about reversing age, but about supporting the body intelligently. Gentle movement, controlled breathing, and consistency give the heart the conditions it needs to perform better. Small actions practiced daily create meaningful change, protect long-term health, and restore confidence in the body's ability to heal and stabilize itself naturally.